Hi there. Another interesting case that was sent to us by our social media. This gentleman is 21 years old, says that he's been receding in his hairline, having some thinning in the crown since age 20, so about a year or so of progression of hair loss. He's not sure if this is male pattern hair loss or if it could be something else. So he's asking that question, whether he'll be a good candidate for transplant or not. That's very interesting and very important to discuss here. Looking at the pictures that he provided, they're not great pictures, but he can tell us some things. If you look closer, you'll see this is the right temple. Very low density of hair overall. There's some redness throughout the hair there that I can see. The crown area also shows some density, some redness. Probably he has androgenetic hair loss or male pattern hair loss, but sometimes people have more than one condition at the same time. When you talk about hair loss, there's a big list of diagnoses, all the way from genetic, male pattern, female pattern hair loss, to very specific dermatological and hair conditions that can actually be dangerous if you transplant into them. So this person requires a workup, and he needs to go to a physician that specializes in hair diseases and hair conditions. Be careful, because sometimes you don't see the doctor and you end up in the operating room and you were misdiagnosed by someone who had no experience on this. So make sure you see a physician, a doctor who does this all the time, sees all these conditions and is looking for these things too. If he presented to me in my office, immediately I would take a step back, ask a scalp biopsy or do some workup to get to the right diagnosis. That way you start the right path. If you start with the wrong diagnosis and you take the patient down to a treatment plan, obviously there's going to be failure, right? So it's important to look at every patient individually in the consultation and address every area of concern. And then if it needs to be worked up, let's work it up before we recommend anything. So if you're in like the situation like this, see a physician that specializes in hair loss. I'm available, consultations are free, just give me a call.